Good morning, everybody. This morning I will talk about the impact and clinical implications of antimicrobial resistance, more specifically antibiotic resistance. I will not talk about malaria and tuberculosis in any detail. So why should we care about antimicrobial resistance? First, let me start with an anecdote. About 10 years ago, in a neighboring hospital here in Switzerland, there was a patient admitted from Croatia. She was the former governor of South Dakota. She went to the Adriatic Sea for a sailing trip. 70-year-old woman in perfect health, grandmother. Unfortunately, she had an accident. She had a spinal fracture. She was hospitalized in a hospital in Croatia and in Zagreb. And unfortunately, after surgery, she developed a surgical site infection with a multi-resistant Staphylococcal aureus. There were further complications. Finally, she was evacuated to Lausanne here in Switzerland, and she developed a very severe infection with multi-resistant Staph aureus called MRSA. She developed pneumonia and other complications, and finally she died in October 2007. So this is just an anecdote, but it shows how antibiotic-resistant bacteria sometimes can really harm our patients. So to be a little bit more systematic, what are the clinical implications of antimicrobial resistance? Of course, there's always the risk of treatment failure. That means that patients are not treated with an adequate antibiotic because physicians may prescribe an antibiotic that is not covering the resistant bacteria. So there is increased morbidity or mortality. To give you an example about treatment failure, here you see the data from an old study published about 15 years ago in a very high-impact medical journal, showing that if you had a population of patients with a urinary tract infection called pyelonephritis, and you compare two different antibiotics, one is ciprofloxacin, the other one is cotrimoxazole. If the bacteria are susceptible to both antibiotics, then the treatment success is almost 100%. However, if the bacteria is resistant to cotrimoxazole, then suddenly the success rate decreases to lower than 40%. So it's very easy. Those women, they will not improve, and at some point they may have to go to the hospital, receive intravenous antibiotics because of antibiotic-resistant bacteria. But more importantly, of course, antibiotic resistance, as I mentioned before, can harm patients and even kill them. Here you see a summary of different studies showing the risk of death for different antibiotic-resistant bacteria compared to the non-resistant, what we call susceptible bacteria. So, for instance, for Enterococcus VRE, the death risk increases by about 2, but for some bacteria like Enterobacter, the likelihood of death because of resistance may be 5-fold increased. Other important implications of resistance is, for instance, that we have to use more expensive second-line antibiotics if some of the commonly encountered bacteria are not susceptible to the standard antibiotics. And to put it very bluntly, this is of course a problem for low and middle income countries. If you have some of these superbugs, multi-resistant, sometimes you have to use very expensive third-line antibiotics that may simply not be available. So to put it very bluntly, the rich pay with their wallets, the poor with their lives. This is a statement by the CDEP NGO in Washington that stated that for some of these antibiotics that are not available in developing countries, if they're not there, some patients may be at risk of death. Then, of course, also another problem is that, especially in the hospital setting, resistance adds to the overall burden of nosocomial infections. And then also, for the future, this is a threat that has been mentioned now many times, that for some of the multi-resistant superbugs, that they may really become pan-resistant. What does this mean? That they are not treatable anymore with any commonly available antibiotics. So this is, for instance, the case for pan-resistant tuberculosis or pan-resistant Acinetobacter. These are bugs that, fortunately enough, in many countries they are not frequent, but there are already some countries where you may encounter these kind of bugs, and this is certainly for us as clinicians a nightmare scenario. Then also there are economic costs associated with antibiotic resistance, especially if you try to control them in the hospital setting. So this is specific to the healthcare setting. You have increased direct costs because you have to use more expensive antibiotics, but you have also infrastructure costs because you have to invest in infection control. In case of epidemics, you may have to do a lot of screening. You have to put patients into isolation rooms. All this brings additional costs. Now, the second part of my talk, the question, of course, what's the overall societal impact of antibiotic resistance? And here again, I would like to cite a recent editorial that was published in Science, that the effects of antimicrobial resistance will be felt most acutely in lower income countries. As I mentioned before, they may not be able to afford the more expensive, newer antibiotics. An example here from India. These are rough estimates that there are about 1 million Indian children that die within the first month of their life. And from about these 1 million children and infants, about 60,000, they die because of sepsis related to antibiotic-resistant bacteria. So this is quite a huge burden on a country like India related to antibiotic resistance. Then you have high-income countries like the United States. This is a report by the US CDC that was published demonstrating that, for instance, about 25,000 deaths per year in the United States were related to antibiotic-resistant bacteria, which puts it into, if you have a sort of a hit list of the most frequent causes of illness in the top 10 of different diseases. So to make it very clear, antibiotic resistance is not among the top 3. There are other diseases that cause more illness burden, like cardiovascular diseases, cancer, diabetes, motor vehicle accidents. But antibiotic resistance still appears among the top 10 diseases in the United States. There have been also some scenarios for the future that have been published recently, but these kind of estimates often are quite imprecise, so I would be a little bit careful because these crude predictions, they are based on a lot of uncertainties and maybe even they overestimate the future impact of antibiotic resistance. So sometimes we have to be a little bit careful not to accept all the alarmistic scenarios for the future. Because there are some methodological challenges, of course, without going into any much detail into any statistics and epidemiological challenges. But we have to highlight that, of course, antibiotic resistance per se is not killing. It's the bugs that are killing. And to distinguish what the microorganism cause, what harm they cause, and distinguish from the resistant bugs, it's not always easy. Then, of course, patients who acquire resistant infections, they may have comorbidities, they have other underlying diseases. And then also a third very important confounder is, of course, the adequacy of antibiotic treatment. You may have a patient infected with a resistant bug, but if he or she gets the right antibiotic right on time, there may be no additional harm. So these are the kind of challenges we're facing, and just as an example of a very good high-quality study that looked at these kind of issues in a very detailed fashion, that's a study from Europe that looked at a very large cohort of patients in more than 500 ICUs, including more than 120,000 patients. They did a very sophisticated statistical analysis called multi-state modeling, again, not going into any detail. And here they showed that among patients who were infected in intensive care units, there was already a high excess mortality related to sepsis, bacteremia, or pneumonia. The greatest burden was related to Pseudomonas, not necessarily to the resistant Staph aureus. Everybody talks about MRSA, but here it was more the gram-negatives, the Pseudomonas. And here, very importantly, the message that antimicrobial resistance contributed only a relatively small contribution to the overall burden of healthcare-associated infections in intensive care units. So, to make it very simple, it's not good for your health to get infected in an intensive care unit because you have lots of underlying other diseases. Resistance complicates further, but the part of resistance on extending the length of stay of excess mortality was not as large as it was previously reported. So to conclude this short seminar, I would just say that still there's quite a consistent data around that, of course, antibiotic resistance may have some adverse impact on morbidity, on length of stay, on clinical outcomes. That's quite certain. That we have now even better studies and increasing evidence that there is added disease burden also from a public health perspective, that it increases treatment costs. Also that, especially in low and middle income countries, the burden of antibiotic resistance may be even higher, but there are not a lot of good studies and estimates available. And certainly that we should focus more on these kind of burden of disease studies in the future to increase the evidence base. Thank you very much.